Yes? Did we lose the sound again? It seems like we lost your sound stream again. Hello, hello?
Thank you very much. First of all, I would like to know if you can hear me. They don't hear me.
It almost looks like you have multiple microphones connected, because for some reason we have multiple like streams of sound, and it's very hard to understand and make it work.
Why you try?
Like we have this loop, I don't know why.
If I use this one, use this one, use this one, use this one, use this one. Hello, do you hear me now? Okay. I try. Don't hear me. So I'm Vanessa Gregor. I'm a founder of Ultraspecialisti and scientific director. I'm a medical doctor. I'm specialized in oncology, and I am an expert in lung cancer. Ultraspecialisti is a social innovative startup that has been developed with the mission to improve the patient journey and treatment conditions. We should do that if we have sanitary systems and everything organized. The point is that there are huge discrepancies among different countries.
Lui non si sente più.
Yeah, for some reason the sound is still not very good. Sometimes it works fine and sometimes it doesn't. And I wonder if the reason could be the fact that it seems like we have you through 3 different channels. Perhaps maybe if you can switch off the 2 channels that are not necessary and then just keep one, because it almost seems like you have connected through multiple computers. And maybe that's why we have that conflict in sound. I'm not sure which one I should keep.
Altri accessi e di rimanere con uno.
Right. The last one, so the lady who was just talking, that was a very good sound. Maybe if you can keep using that one.
Okay.
Yeah, this is very good. Can you talk in that microphone?
Okay. Now I can talk.
Yes,
Okay.
yes, this is good. Very good.
Once again. So I'm Vanessa Gregors. I'm scientific director of Ultraspecialisti. Ultraspecialisti. I'm a medical doctor specialized in oncology, and I am an expert in lung cancer at national and international level. So Ultraspecialisti is a startup with a mission to improve the patient journey and to obtain best diagnosis, best treatment. Obviously, the question is why you should be those who have to improve patient journey, because the health is so important, and we have national organization at a national level with the mission and with the objective to do that. But the point is that there are so huge differences between different countries. In Europe, so the discrepancy is so great that there are survival rates which are really quite different for the same disease. The reason is the reasons are different. First of all, the point is that there are not available drugs for all diseases in every country in the same time. Sometimes we have to wait 2 to 5 years from the FDA approval to obtain drugs in some countries. Moreover, there are some differences in expertise. The medicine has been evolved, fortunately, and even I am a medical oncologist, I'm not the best person to be contacted if you have some person to be cured for colon cancer. I'm not the best person for that. I know who the persons are, but I'm not. I'm the expert in lung cancer, and I know the community of 100 best doctors on lung cancer in the world. So there is the second point. So there are discrepancies in advances of the accessibility of the drugs in different countries. There is another point because the expertise is not anymore distributed regularly on geographical point of view, but there are centers of excellence that might be mostly 10 per country when you really can reach the best experience and the best treatment and best diagnosis. So only in Italy, if we talk about this country which has 60 million of people, only in Italy 1 million of people travel every year from region to region to reach the best optimal treatment.
Wow, that's only in Italy? That's impressive.
Moreover, this is only in Italy, 1 million, yes.
Wow.
64% of Italians are searching and trying to obtain information about the health on web. So they want to know from the web. It's immediate. They feel comfortable to ask. They want to have information immediately. You can imagine if we are facing very severe disease. The problem is even more important. And this problem is not only relative to the patient, but also for the family and all community. So the reason is that people travel from the one region to another because the expertise is different, even though Italy has one of the best sanitary systems in the world. And is one of the 6 best countries to be treated. You can imagine what happened in other countries. So first of all, there are disequilibriums from geographical point of view, from political point of view. There is no information. People are not informed sufficiently. So we can have a very young man, for example, having lung cancer in some of our countries in Europe that is not be able to receive the best treatment, and probably he doesn't know that there is a treatment for him. So other question was that even those patients, caregivers, or people who are able to move on the web, identify the expert, and this is second step. So then that means that they know something about the web, they are able to move on the web, they are able to find the expert, then they try to talk with the expert in a completely inappropriate way. And these are examples from my clinical practice. I receive information by post, by fax, by messenger, by WhatsApp. They ask me for the help, and it's really, really difficult to offer to give the best clinical evaluation of the patient in this way. So this was the base of the fact that we have decided to create a platform that may facilitate the communication between the patients and the doctors in a proper way and in a proper format. But this is not the core of our activity. This is just an instrument we use. But what we have to do is to give the possibility to a huge number of the patients or caregivers to reach this platform, to identify the best expert, communicate through the platform, obtain the suggestion for the treatment, and if it is necessary also to receive then the patient and treat them. So you can imagine somebody living in Albania, Bulgaria, that has to cross geographical and political barriers to reach Italy, for example, or other countries, to obtain medical information. So first of all, they have to know where to go, who to reach, how to travel, pay for the traveling, invest time. If we offer them the possibility to find these informations on the web and communicate with the expert through the web in a proper format, and I will tell you what does it mean, then we can easily save time, money, and help them to have better patient journey and to obtain the best diagnosis and treatment, putting them in a connection with the community of the doctors who are really experts in different fields. Obviously, when we are talking about the proper format, we are talking about different issues. One of the important issues is not only technology, but is also legal aspect. We have to respect the normatives for the private data and sensible data. So how the patients may use the platform. So patients find Ultraspecialisti on the web, then register in a proper way, then they enter in a safe and comfortable area when they can find the medical field of interest. We have started with oncology. Obviously, it is my field of interest, so it was easier for me to start from this field. So they go through oncology, and then within the oncology, they can find the sub-area of interest. So we have splitted oncology in more than 30 separate diseases. But we have also tried to find the best language to communicate to the patients. I cannot talk to them about ALK translocated adenocarcinoma of the lung. Nobody knows about that. But we can find the subtype, sub-area of medical area talking about the lung disease, lung oncology. So because the patients know the organ which is to be cured. Then when they save.
This point is very important because in this way we are in very high level specialization.
Right,
so it's
right.
not a general solution, but a vertical solution, I can say.
Exactly. Thank you very much, Antonio,
Yes.
for this precision. Because when we are talking about oncology, as I told you, I'm not sorry about this because you specified that. So I'm a lung oncologist. I'm not breast oncologist, but within this platform, there are different experts in different fields involved. Okay, so we divided oncology in different sub areas, and for every sub area there are specialized experts that patients or caregiver may identify. So for example, if the patients or caregiver choose lung cancer, he will find then different experts on lung cancer, which might be surgeons, oncologists, radiotherapists. Now you will tell, oh my God, I don't understand what I have to do here. You don't have to worry, because if the patients or caregiver make a mistake, the doctors will address them to the proper doctor. So, you know, this is an algorithm that helps the patients and family and caregivers to find the best expert. But if the algorithm fails, the doctors will readdress them on a proper expert. Obviously, what is important? It's important also to have in proper format of communication. So one part of these informations are linked to the medical history of the patients. Medical history means everything that happens to the patients, every drug they use, every symptom they have. So they have a possibility through multiple choices to explain to the best expert what are their troubles or problems to be faced. And there are multiple choices, but they are not obliged. They can answer what they want. After that, which is very important, they can also submit all medical records, including imaging, from their home through internet communication to the doctor. So there is a device which upload the files with the imaging, and medical doctor has a viewer from the other part that help him to properly see the imaging and to also work on that in a proper manner. And in the end, after the analysis of medical history and all documents that patients send to the medical doctor, including medical records and imaging, medical expert is going to release an expert opinion. And obviously this expert opinion has to be delivered in 5 working days. Moreover, we were testing through our validation process the user-friendly experience of the patients, caregivers, and doctors, and we are updating and upgrading this platform. So we have started at release 0, and then we moved to release 1. Now we are releasing release 2, and we are planning other releases because we are upgrading the performance of the platform. But as I told you, platform is just the instrument we offer between the patients and the doctors to communicate in a proper way. What is also important is to identify the best expert. And what does it mean? So we have the selection criteria, objective selection criteria, which are not only linked to the publications or scientific work of this expert, but are also linked to the fact that these doctors have to prove they are involved in innovative strategies, in study protocols, innovative therapies, and also have to be updated and check these criteria every year. We have created an advisory board, independent advisory board, that also supervise the selection of the experts. So it is important because we have to guarantee for the patients and for the caregiver that who is going to give the medical opinion is really an expert. Another point, very critical, is that this communication has to be supported. So patients has to be supported, caregivers has to be supported, and medical doctors has to be supported. The point is that they don't have to be supported only from technological point of view. But if I want to, make a summary of what I mean, is that for the medical doctors, case management team is working as a back office. That means that medical doctors have to visualize the documentation of the patients, give their opinion, and then clarify any question from the patients. From patient point of view, we support them to identify the best appropriate expert for them, to upload properly documentation, identify which documentation has to be submitted, and also we are timekeeper. We are following the fact that medical doctors has to answer in a proper time to the patients and the caregivers, which means in 5 working days. Moreover, these experts are involved in research. That means that we we are creating the networking of this community of the expert, but also we are giving the possibility of the patients to be included in clinical trials, which is very important, especially in those countries in which the delay from the registration of FDA of the drug and the arrival of the drug in that country is 2 to 5 years, and some of these diseases means 1 year of survival if you don't receive the right treatment. That means that if we allow the possibility to be included in a clinical trial, we improve not only the quality of life and the quality of patient journey, but we really improve the survival. So it's crucial to have experts. Moreover, as you know, today not only in oncology, in any field of medicine, there is no any possibility that only one person can have all answer for the patient. So the multidisciplinary approach, multidisciplinary team is fundamental. And this platform allowed multidisciplinary approach. That means that I can share and discuss some patient cases with one doctor in United States, in Holland, in Poland, or in Albania, whatever they are. Obviously, as I told you, the customer, I have already talked about the customer service. It's really very important, and we have realized that support patients and doctor, and we really think that special training is needed for the people who are performing activity of customer service. From business point of view, now I'm going to talk about the B2C model of activity, and then we are going to talk about the B2B. From B2C model, we have to cover the cost of the medical service, and also we have to cover the cost of the customer service and of platform use. So what is important is that we have decided that the price is flat. And we don't have any negotiation between the different doctors. If they are at very high level, for us they are equal, and they cannot ask different prices. So this is also important because gives the patients the possibility to obtain the medical consultation independently of which doctor they are facing with the same price. This price has been decided through the focus groups. So patients were suggesting this price. And doctors accepted this price because we made the focus group with the patients and also with the medical doctors to decide not only the pricing, but also how to develop the platform and how to develop the process. So as Antonio said, we started 2 years ago. We work hard on development of the platform. Platform has been created and imagined and created by us in collaboration with Exprivia, which is an international company dedicated to the health. And after the platform has been developed, the customer service was built, all process has been defined. We went on validation. First of all, we have performed the consultation for free in order to test the platform and to test the process. And after we did that, we went on market. So what we have learned from this experience. So first of all, we have started on Italian market. So our idea was to start with Italy. So the platform was in Italian. But what we have realized that we have received also requests from Romania, Bulgaria, Australia, Greece, Croatia, Sweden, and Spain in the period of validation and even immediately after. So we have realized immediately that there is an international need for that. So the important point is that the majority of the patients have been said that the treatment they are receiving is correct and that they will be reassured that they may stay and remain their home and they don't have to travel. So we have reduced unnecessary travels, unnecessary migration from the region to the region. But from other side, in those patients where the treatment has been differentiated from that they were receiving, the 50% of them enter clinical trials. I want to say some examples. First, I remember very well the example from the Spanish woman. She is a very young woman with 2 daughters. She is lonely. She is living in Palma de Mallorca, and he had recurrent breast disease. She was in trouble because they were not able to perform the diagnosis, proper diagnosis to decide the treatment. So she contacted us, willing to come to Milan. At that time, customer service has identified the best expert for her disease in Barcelona. So we have included this doctor from Barcelona in our platform. She has performed, this doctor is a Greek doctor working in Barcelona. She has performed medical advice for these patients, help her to continue treatment in Spain. Another case, for example, is a young Italian man with sarcoma. He's treated in the best suitable hospital in Italy for sarcoma, but he has already performed any treatment, available treatment. And so he asked us for the help. We have connected him with a Holland expert from ERTC, and he had the opportunity to enter in a clinical trial. So these are just examples of what were happening in this very preliminary experience. So what we have realized that average age of the patients were between 60 and 80, which is the majority of the oncological patients, but the average age of caregivers were between 20 and 50. So the people found us through Google, Facebook, and awards. The majority were from Southern Italy, but not only. There were also examples of the people from Milan that asked the consultation through the platform because they were unable to find the family solution for the time of the visit. Another thing I think very important is to say that what I have realized and what was my afraid as a medical doctor is that the communication between the medical doctors and the patients are going to be very cold, very, not friendly.
Right.
But at the end, I realized that patients feel very comfortable to write to the doctors. They have time to think what they have to ask. They have time to fill in the questionnaire. They have time to read our consultation. They have time and they have also opportunity to ask us to explain and clarify what we have written.
Right, right.
So, and moreover, I have also realized that as a medical doctors, we have to change our modality of communication. We are not writing a medical opinion for their medical doctors. We are writing medical opinion to them. We are writing the medical opinion to Simone. We are writing medical opinion to Maria. And we have to write, Maria, you have this disease. The best thing for you is that. The best opportunity is to go in Sweden or go into Germany or to receive the treatment in Spain.
Right.
So we have to explain them why we are telling that. We have to write that. And today, when we are visiting the patients, especially for the consultations, we have 15 minutes. While through this possibility, patients have more time.
Right, right.
To prepare what they have to ask. They have time to think, and they have time to ask for the clarification and explanation.
Excuse me, I have a question.
Yes, go ahead, please. Julissa, go ahead, ask a question, please.
I wanted to know that, for example, like the patient, when he's going to be treated properly, like the first diagnosis that he gets, he needs to go to the physical hospital. For example, I go to the physical hospital, then they check me up and they say, I don't know, you have diabetes. And then I continue my treatment and everything, but all the consultations I make through this, using this platform, or is that I have the first symptoms, I don't know, and then I use this platform, and the first opinion I'm going to receive is from here, that they say, oh, you probably have, I don't know, diabetes, and then do this test, and then I show to the doctor in the platform, and he says, effectively, you have diabetes. Then you can follow this treatment. It functions like the second way or the first way?
This is excellent question.
Excellent
Thank you
question.
for asking me, because I just skip out through that. But this is the beginning, yes, from the patient's point of view. In fact, we expected that the majority of the patients will ask for the consultation when they are in trouble. So the majority of the patients are in trouble when they have to change the treatment. So this means a more advanced stage of their cure. But sometimes happened also at the first beginning when they, for some reasons, don't have the diagnosis. So there was another example. There was a family from Milan trying the best expert in a very particular hematological disorder. They went to States and they have realized that one of the best experts is in Milan. So sometimes happens also that sometimes at the first step, there may be some criticism. Obviously, for example, the diagnosis of the diabetes will be more easy, and while you increasing the seriousness of the disease, or you are talking about the more advanced stage of some diseases, even diabetes, for example, might be a very serious illness, then you probably need more expertise, probably also multidisciplinary team that may help the general practitioner or the specialist who is not ultra specialized, or the patients if they don't find the right person to talk about. I don't know if I was clear with you.
Yes, but for example, if the person, like, I don't know, he receives like the first medical opinion, but probably he needs to be checked up. I don't know. I have been to the doctor many times, and he always like uses his, I don't remember the name, but those medical equipment they use to check you, and then he touches, for example, the part that probably hurts, and that kind of things. I think that from telemedicine, that
You're talking about the physical examination.
Right,
yeah.
physical.
Mm-hmm, the physical examination, like that would be, okay. That won't be.
We love, we love a lot the physical examination of the doctors. We feel more comfortable when doctor touch us. But today medicine is very much more advanced. So obviously we need the physical examination. I'm not telling that we don't need the physical examination, but in some particular nodes of the diseases and step of the diseases, the question is what we have to do and not what we see or what we know about the patient, because we already know everything about the patients. We are not talking about the patient who is well and then has a pulmonitis. This patient is going to the general practitioner and will receive antibiotics.
Right.
We are not talking about the patients that need first aid. They are going to the first aid and will be addressed in that way. We are talking about heart disease.
Oh, okay. So this platform
or oncology. So we are talking about very serious disease where we need the experts. So at that time, the patients have already performed first level examination or second level of examination. Obviously, if medical doctor to the platform realize that something is not clear, that we have not received all information, sometimes in the medical records, we also see the physical examination already done, like thorax, okay, abdomen, okay, no sign on heart rhythm, everything okay, everything is okay, but he has a cancer. For example, brain tumor, but it's okay. So, at that time, the physical examination is important, is a part, maybe also delivered in collaboration with the general practitioner, or if needed, maybe planned. But then probably you will skip the first contact of the patient because you will program his visit if you need to visit him or her, planning what she or her have to bring to you. For example, in this case that I have shown, for example, brain tumor, maybe that it has been found by CT scan, but the medical doctor needs MRI and then has to plan the biopsy. That means that he's going to organize the biopsy or the radiosurgery treatment or neurological treatment, and then is going to organize pre-operative period of visit, examination, and so on. So that means that this platform may be also useful in planning what you are going to do with the patients before she or he comes to the hospital. It depends on the disease. So for some diseases, we really need first level examination that will be done by general practitioner. Then we will have some documents that might be seen by platform. For some other patients, we will be more far away. They will already have different physical examination, different exams, probably 2-3 years of the history. We can see 2-3 years of the history very well organized in the platform. For some patients, we will receive the documentation. We will ask integration of the documentation, and we will solve this by the platform. For some of them, we are receive the documentation, ask the integration, and plan the visit. So this is not solution for everything. It's an integrative part of the new way of how we can treat the patients.
We have a few questions, if we may, if it's a good time. One, what countries do you work with? Do patients have to come from Italy, or can they come from different countries? The same thing with the doctors. Do you work only with the Italian doctors, or if somebody wants to sign up to the network from a different country, would that work?
So this is another perfect question. So we did the validation first in Italy, then we went on the market, and now we are covered oncology very well with all experts for all areas of oncology with Italian doctors. Now we are opening and searching for the doctors from other countries, and we have already some experiences because the patients ask us to find them solutions, but we are including medical doctors for the oncology from other countries. We are opening new area of medicine. So we have finalized oncology. Now we are open the internal medicine, some sub areas. We are preparing surgical area in Italy, and we are immediately trying to identify those doctors who may be included from other countries. So in this time, we are searching for the experts from different areas, also from other countries. We are able to receive requests for the medical opinion from the patients from the other countries. We have already did that. We help them to translate documentation, and the communication were mainly in English, with the exception of the one Spanish, because we answer in Spanish, and one Croatian because we answer in Croatian.
Here is also a question from Millicent Adusei, and he is asking about the payments. So how do customers pay for this service, and how do the doctors get paid when they perform services through your platform?
Okay, I'm going immediately through this third question. Just to finish the second one, I think I missed one. So the point is that this internalization, so this expansion versus other countries, is why we are here.
Right, right.
Okay. So that means we are here because we want to involve you, include you, and try to work with you on that. So to study the laws of other countries,
exactly.
To realize we can go through other countries, because we did already. There are no laws, I think, in some special countries, but in others they are. So we have to learn about the laws. We have to create the strategy, how to include other doctors, so how to move quickly. Because we have realized how to do the process. We have instruments how to do this, but we have to go quickly. So this is one of the reasons we are here. Regarding this, the other question, so the medical so the patients, how they pay? they do pre-booking with the credit card while they are sending the request to the doctors. They pay when they receive the doctor's answer back. At that time, this pre-booking from the credit card will be charged when the mail, when they receive the mail suggesting them to go to the platform because they have obtained the medical opinion. The doctors have a contract with us. They are not our employers, but they have a contract of behavior. So they have to sign that they accept that they're going to charge the patients as we have decided. They have to respect 5 days, and they have to know that we are supporting them and patients in this interaction. We pay them.
Excuse me. No, there is an important point in this case.
Yes.
We are not like an hospital. We are not responsible for medical consult. Okay.
So we pay medical doctors the next month for every consultation they have performed. We have administrative people who are searching, who are having the notes of how many consultations they have performed. Moreover, patients have doctors release the administrative document that they have that he or she has performed the medical consultation and the amount. So it's completely commercially legal issue from sanitary.
Yes. Yeah, yeah. Here is a question from Carlo Alberto Calcera. He's asking, how do you select your doctors? Which criteria do you use to add a doctor to your network?
Mm-hmm. Okay. Yes, I told that there are selection criteria. So first of all, they have to prove the document that they are medical doctors. Otherwise, everybody can decide through the web to give medical advices and who know if they are doctors or not. So somebody has to check this. So we have to check that they are doctors, that they have specialty in the field of interest. We check their publication. If they are in the field of expertise, they are candidate. We search if it's really that they are called to present at national, international level and share the expertise with other colleagues. They have to send us the proof they are involved in clinical trials of improving technologies or innovation in medical care. And this is something absolutely objective. And then we ask also 2 recommendations. Two letters of other colleagues. They are going to they describe how he works or she works, and especially what we need, they have to specify that this person or this doctor is able to work in a group. That is not a solitary one, but that is somebody who is used to work in a multidisciplinary team. And they also have to prove they have the clinical experience for more than 10 years. And that they have worked in a multidisciplinary team. So teams, these are the objective criteria.
Right. And there is another question from Carlo. Another question from Carlo. Do the patients have the opportunity to evaluate or rank the doctors, like an Amazon product ranking, for example? So can they here give a doctor 5 stars or 4 stars or some other feedback so that the other patients can see which doctors are good and which doctors are not?
This is also an excellent question. We were discussing about that from the beginning. So we want to be protective in this phase, because even if it seems so simple, and it is simple, we are really challenging a cultural modification of the connection between the medical doctors and the patients, because everybody is talking about the telemedicine. In fact, telemedicine is promoted between hospitals, in war industry, and for the remote following of the patients with the cardiovascular disease, for the blood pressure, and for cardiac rhythm. But what we are doing is not already used. So first of all, we have to create a new culture and be protective with the patients, caregivers, and with the doctors, because these are in fact real challenges. So if we immediately now leave this opportunity, probably we may create confusion and mess. We are planning this, and we are going to do this, and this is planned for the release number 4. Now, release 2 and 3 are willing to improve multidisciplinary team and possibility to interact with the other specialties in other countries in the same time. So this is going to be done, but we don't want to do it immediately.
Now, Lawrence and Julissa have a few questions. I added you to the panel here. If you would like to ask them live, go ahead. Otherwise, I can read your questions.
Okay. I wanted also to ask if the patient need a soon response, like less than 5 days. Could that be possible? Like, I don't know,
Absolutely.
there is a list of doctors probably that say, I'm available now, so you can ask me.
So I have to tell you that in the majority of the cases, the doctors answer within 2 days, 24 hours, 48 hours. When we realize we have a very urgent issue, like, for example, when May Day happens, the urgency is mainly psychological or organizative. It's not a health urgency, because health urgency cannot be solved by the platform. So what may happen, that patients write to the platform on Friday because they have to start the treatment on Monday in some other hospital. They are not sure if the treatment is the proper one, and
Right.
they ask the doctors to give advice if it is okay or not what they are doing. Obviously, that's different. In different cases, we have answered on Saturday, on Sunday also, you know.
Right.
It's
Second
not so
opinion.
difficult.
One more question. In countries like the United States, where the healthcare is very, very expensive, would it make sense to use a network to save money? So even though there are specialists here in the United States that I'm sure can offer advice, but they're so expensive that maybe I would like to get an opinion from a doctor that is more affordable, perhaps maybe in a European country where the quality of the healthcare is good or better, but the prices are likely lower.
I agree with you. We were trying to have the price which may be acceptable also in economically weaker countries, you know, in developing countries. So obviously, for the most advanced and more developed countries, this price is low. We know that.
Right.
But this we have discussed with our medical doctors during the focus groups, and in the end we have decided that they have suggested this price is a reasonable price. So you're right. If we may offer the medical consultation also for the patients from the United States,
right?
Because the medical experts know what is possible to be performed in any country.
Yeah, I can imagine that there would be a big demand for your service, especially from the United States, where the cost is just outrageously high. Anyway, we have another webinar in a few minutes, and I see we still have questions from the students. So we probably have to stop here, but this is a fascinating, interesting topic. And as I said, like literally, you can change the whole industry. So students, first of all, we will have another webinar later in the semester. So you will have an opportunity to again engage in a discussion like today. But as always, if you have more questions, if I missed any questions, and I think we answered most of them by now. But if you have any other questions in the future, just email them to us. We will forward them to the company, and obviously we'll try to answer them so you will be able to communicate by email. So we probably have to stop here now. As I said, we have another webinar in 1 minute, so with another company. But thank you so much for your time, and thank you. I know there are several people from Ultraspecialisti here, so I know you took your, that time from your busy schedule. So thank you so much for finding the time to meet with our students. I don't know, any maybe final concluding remarks before we end the meeting?
I would like to thank you for your time, and also said that we are other opportunities to explore, like B2B models with the pharmaceutical companies and hospitals, and we are open to discuss with those students who are interested in that part of activity to contact us also directly.
That's a promising area too, so I hope the students will provide many good ideas. Well, thank you so much. Truly appreciate your help, and we will be in touch by email in the next several weeks. So there will be probably a little bit less communication while the students are working on their challenges. But then we will have another webinar in about a month, and the students by that time will probably have many more questions. And then if everything goes fine, in early May, we will have a stack of reports for you, and I hope there will be good ideas in them.
Thank you very much.
Thank you. Thank you so much.